Kevin McGovern. If you would like to work with me directly, please visit my website, perfectmotionsportstherapy.com. It's got all my social media. You can also email me at drkmac@perfectmotionsportstherapy.com. That's Dr. KMAC at perfectmotionsportstherapy.com. Or it might be easier just to text the word game show to 978-651-1812. We've got another good show for you today, so grab a drink, sit back, relax, and get some knowledge. Thank you for listening. All right, everybody, how are we doing today? It is the fifth episode of the game show, and today I have my first guest, Dr. Dennis Shavelson, who we had met like most people meet nowadays on social media. And I think we met over a LinkedIn conversation, and that brought us to a phone conversation, and we spoke, I believe, for almost at least an hour and a half, maybe even longer than that, our first conversation. And we found out that we had a lot in common, and we're going to talk today essentially about what we both have delved into, which are cash-based medical services, which were probably taboo 30 years ago, but now are coming to the forefront by offering specialized and significantly better care. So I'm going to let Dr. Shavelson tell the audience, you guys, a little bit about himself. So without further ado, all the way down in Southwest Florida, Doctor, are you with us?
Yes, and I'm sorry for everybody who's suffering from the snow. I hope we can be a little cheerful here. My introduction is a long one because I'm 77. I started out as a board-certified foot and ankle surgeon in New York City as a hospitalist and chief of podiatry at Mount Sinai Medical Center. And when they told me to bring my surgical packs to the OR so that I can sterilize them, I realized that my days as an insurance-bound doctor were over. And that was probably about 25 years ago. And so slowly I made my way towards away from what I would call get sickness into what I call wellness, because in the Webster Dictionary now, a patient is defined as somebody that has a diagnosable disease. And if you're well and don't have a diagnosable disease, your insurance will cover you for 2 wellness visits a year, and that's about it. No performance enhancement, no quality of life upgrades, no prevention, just get sick. So as a podiatrist, I was a pretty active athlete years ago, 6'2", 220, and I had one leg that was kind of short, and after I played some serious ball, I had to lay down on my back for 2 hours, started working with lifts and figuring out how I can fix myself, and said, this is great. I got into podiatry school. They're going to teach me how to fix everybody, and all they taught me to do was wait until they needed a bunionectomy. So I've sort of been on my own path ever since. My 53-year-old daughter has never had an antibiotic, and she had a Waldorf education, and my 4 other kids are I don't know what, they're Nordstrom shoppers. They're different. But I guess I've gathered information like a sponge from many, many sources, leading myself to now being, I left my practice in New York City because COVID, I was in the financial district doing really, really well. And COVID took away my bankers, my finance people, my Google people, my stock market people, because they were all working from home, and overnight that was the end of my practice. And that gave me the opportunity to go down to where one of my 5 kids and 3 of my 7 grandchildren live. And now I'm a certified health coach. It's Snap Fitness. Here we are, commercial. And proudly, I can tell people I'm not involved in insurance. I can't even submit an insurance claim kind of thing. And I'm working full body. So I say that I'm biomechanically and bioarchitecturally and human movement wise, I'm working from the ground up. And a lot of the specialists that I meet, they're targeted to their location. If it's a back problem, they're working from the back down, the pelvis down, the pitching arm, the whatever. And the way I start saying it, I'm from Brooklyn, so I'm going to probably say some sayings that are a little bizarre. But if God wanted, God wanted us to be different, He would have put our brain in our butt, but He put it on top of our heads, and from the feet up, we spend our lives protecting that head so it can see and think and not be rattled. And everything starts at the level of the foot. And I think most of you know, doctors examine you with your socks and shoes on, and foot complaints and diagrams and stick figures are all showing everything, maybe the ankle up. And so what I offer to everybody is not to change what they're doing, but to add stability, 4 S's and a B, SSSB, stability, support, strength, symmetry, and balance at the level of the foot. And that would change everything, the outcomes, the injury rate would be reduced once you do the rest of whatever you're doing. So is that enough of an intro, or should I keep going?
No, I think that's great. You and I, in that conversation, we have we have a ton in common. I start my every exam from the feet, whether someone comes in with a neck or a shoulder, because the feet are going to tell me, if they're moving. If they're not moving correctly, if they're locked, they're going to tell me that we've got a deceleration problem, at least for the stuff that I handle. We've got weakness in our glutes, hamstrings, adductors, that the foot's taking and pounding without being cliche. And then that's going up the kinetic chain and, into lats and scapular depressors. So when someone's, and you can't even, and an insurance, you'd fill out these forms for insurance, and I'd be like, get on with these reviewers. Why are you looking at the foot? They've got a neck problem. Yeah, did you go to school, dude or dudess? I'm looking at the foot because the body, we don't go to the shed and curl the lawnmower, right, to cut the grass, right? It's a whole body movement. And, some of the problems that I'm running into, Doc, and I don't know about you, is when I do marketing, I wish I can get rid of the PT after my name. Somehow just call the education something. But people have such a negative connotation of physical therapy because most have haven't gotten better because the problem wasn't addressed, right? But people become satisfied with it. Or I always say, if you hired a painter to paint your house and you came home and a third of it was painted, you would not be satisfied with that. But people get satisfied with yeah, I'm out of pain or whatever. And because that's the insurance model. The insurance model is to keep you unhealthy, right? Because if it was to keep you healthy, they would pay for preventative medicine, which would save them gazillions, right? So, in my practice, I've got people on 6-month and year plans just to keep them healthy.
Yeah, well, I guess I dig a little deeper and I could go into some of that. If everybody knows, there's a neurological sign called the Babinski, and the Babinski is a stroking of the bottom of the foot. And when you do it, the big toe goes up in the air and the other toes fan. And that's normal until the age of 3, because the Babinski is a sign of a severed spine. If you have an auto accident or something. So beyond 3, if you have a positive Babinski, you're in big trouble. And at 3, the body starts attaching itself from the head to the foot. The neurological system, the myofascial system, the connective tissue, the afferent, efferent, all these things get connected. And what we're doing, I kind of mentioned that a 3-year-old horse wins the Kentucky Derby, and we can't even kick a soccer ball at 3. So I'm looking at what do we do? What are we really learning? And we're learning 5 things. the 4 S's and a B. So if I want to walk, I lift up my foot and change my balance totally. I move my center of gravity forward and I begin falling. And then I somehow create stability and support to control that fall so I don't fall on my nose. And little kids and old people walk with a very wide, their gait is, their angle of gait is outward. But what I've learned to do is control those 5 things, if any of them are off, to give you back that ability to stop compensating for all of these steps that you're taking that are wrong. So if you're really great at doing, I don't know what, a baseball throw on an unhealthy foot, you're learning to accommodate your body to do as well as you can. And once I give that foot architectural strength and support and balance and engineering capability of moving itself, everything else just gets better, because all those other muscles don't have to, the brain doesn't have to think of finding another muscle to do the job that your actual muscle down there is going. And the way I would put it summarily is that the more you're involved in wellness, the more you're involved in root causes. The more you're trying to cure the real problem that exists, and not the symptomatic, not the bunion or the iliotibial band or the plantar fasciitis or any of those things, because those lead to pain pills. And in other words, the doctor made me comfortable. Yeah, but I still fall 3 times a day. But this arch support is not soft enough. Well, why don't I just give you a big pillow or teach you how to live in water? But if we want to really function a long life, longevity, fitness, then we have to talk about root causes.
Yeah, it's amazing when you talk about that, how physical therapy has gone the way of now Massachusetts requires continuing education units. They never did, because there's this push for all this research. I'm not saying I'm against research, but some of it that comes out, obviously, as a physician, you can change the outcome of any research you do, by messing with the data, changing the people. Electric stimulation work well. Now all of a sudden, well, no, we need laser, or we need high-speed compression. But we're never doing any studies of one technique versus another, right? So there's all this stuff out there, and no one really addresses, like you said, the root causes. You have plantar fasciitis for a reason. It just didn't all of a sudden start having, tendonitis in your foot. Or you have iliotibial band syndrome for a reason. But insurance doesn't pay for the reason. They don't pay for the diagnosis of the reason, but they will pay, as you said, for MRIs, right? I've never heard anyone denied for an MRI. They're going to pay for pain pills and medication, because that's where all of the lobbyists and that's where all the money is. And people go unhealthy and they go unwell. And as you know, I deal with baseball players, and my favorite team, the New York Yankees, has 4 players. Right?
Go Stripers.
Yeah, 4 players that are out now.
Aren't you in Boston land?
I know, but I'm still from Connecticut originally. So, they got 4 players that are out already for a significant time. And, then I turn on Fox News, and there's that reporter who a year ago was blown up, lost both legs, his eye, and he's already written a book, and he's back to work. So it's just like
Yankees had 11 people with Tommy John surgery, 2 outfielders.
They did.
And they have enough money to have the best. So I'll interject that there are 2 types of research. One is called deterministic, and the other one is called stochastic. And deterministic research eliminates variables. I have one pill, one pain, and I choose a society, a cohort, a group of people that I'm testing, and I eliminate as many variables as I can. So the tragic example that I bring up of deterministic research is that when COVID first came out, we couldn't give the vaccine to anyone under 18 or a pregnant woman not because it wouldn't help them, but they weren't included in the cohort because they would have ruined the results. And so for 6 months, thousands of women, children, and babies died of COVID, or their families suffered the existence of the disease. And it depends on an algorithm. There's a linear curve. And if any of you are scientifically oriented, which I think the group is, there's dots all around that are called outliers. Those are dots that don't fit in with the result that you want to get, and those are the people we want to treat.
Right. That's what you said. The
So
result we
the
want to get.
stochastic research maintains the variables. It's fat people and old people and young people and active people, and my only variable is one of my patents, which is a foot typing system like blood typing that divides feet into 5 different subgroups, that tells you whether your problem is in the rear foot, the midfoot, or the forefoot, or any one of the combinations. And therefore, I'm examining, let's say, the back of the foot is very stiff and not moving. That's called rigid. The front of the foot is incredibly flexible. That's most of us. We do pretty well in the back of the foot, but I do 10,000 bunionectomies compared to one plantar fascial procedure. And the reason is that if I examine 1,000 people with that foot type with variables, I'm going to get much better results. Watch my words, that are clinically applicable. Because everybody's got these unbelievable data sheets and all the things they're getting from what they're doing, and they have no idea what their, I don't know what you'd say, of the root cause of what their problem is. And most of the research that's coming out in bioarchitecture and human movement and body working is proving that whatever we're doing is wrong. Real solid research. So I guess the root of I keep saying root, the root of my practice is that I'm offering something to people. I say to them, if I could make you walk at 80 the way you walked at 40, would you pay me a couple of $1,000s? There's nobody who ever said no.
Mhm.
They might not have the 1,000, the couple of grand, but nobody would ever say no. And I always tidbit here in my practice as a podiatrist. I went to the pharmacy and I took a picture of in the counter, the area for travel. There's little tiny toothbrushes and little tiny combs. And I went to the little tiny foot powders. They were 68 cents. I bought them by the gross, and I sold them to my clients who had sweaty feet or dry, athlete's foot or whatever for $3. Watch my lips. And I got them to open their wallets. They never questioned whether or not, in other words, one problem on the scale that Kevin's not mentioning is the doctor's incompetence of quoting a fee and collecting money. Yeah. We were never taught to do that. We were servants. When I was young, I walked into the barbershop and they gave me a free haircut. Now they charge me twice as much. It's the reverence is gone, the service to the community. I'm supposed to be perfect. If I'm not, there's malpractice. And yet I'm not dealing on washing machines. Everybody wants to be a vet because the dog can't complain. It's the hardest profession, medical profession to get into. So what I want to do is develop rapport, a knowledge of who the client is or the patient. I'm calling most of my people clients now instead of patients, because if you're well, you're not a patient. Remember the dictionary. And at that point, I'm giving them an option. I'm giving them an option of happiness and comfort and fitness. And I work in a gym, and in the gym, we have the main class there is Arnold Schwarzenegger, and I'm looking for Bruce Lee. It's when Arnold was winning his Mr. Universe competition, he was 270 pounds, and you've never seen an Arnold type on a football field or running a road race or in a basketball game. Or 270 pounds of muscle is just as bad as 270 pounds of fat.
Sure is.
So again, we're giving them goals, we're giving them orientation, but the most important thing, we are in contact with them. The decision makers now, there used to be thieves and crooks in medicine, and they were just out there to make a lot of money. Those people now have MBAs, and they run insurance companies and healthcare programs and hospitals, and they're up there. It's like the judge, and who's up in this ivory tower deciding which homeless person should spend a year in jail or not. We're the people that live with these folks. We know their dogs' names. We know they coughed last visit. Now I'm saying, how's your cold? And we're the ones that belong with these tools and these offerings. And again, we have to educate it to the public when there's billions and billions of dollars and political savvy and energy to keep them from ever learning it.
Right. Yeah, like I said, it's difficult for me to almost have to explain when I'm dealing with someone for the first time, explain my way out of physical therapy. But I'm not a physical therapist. I am, but that's not. I'm treating the entire body. I'm treating your mindset. I'm treating your fitness. I'm treating your wellness. And there is just, unfortunately, sometimes such a negative connotation, or sometimes people can't see the light through the tunnel. We're looking, what do you mean I'm going to be able to do that? I went to 3 other PTs. What makes you different? So you're always having to educate them or convince them that, look, this root cause, this area was never addressed. And I'm looking at it. I always say it's like McDonald's value meal number 1. It's very clear to me what's happening, and the fix is so simple. You just have to let me fix it, and the result will be, exponential as to what you can do when you're fixed. But most people go around, as you probably know, unhealthy, unwell, and they think that is where they're supposed to be. Or sometimes, like, I don't know about you, but one of my questions that I ask people is how many discussions have you had about your health on social media? And if that answer is more than one, I won't even take them as a patient. And the reason why is because sometimes people get so used to being unwell that becomes their personality, right? And if you treat them and got them better, they'd have nothing to do. And we'd ask them, because I ask people, so what would happen if you had X? Are you able to do Y? And you'll see the blank expression there. What do you mean? Well, let's say you didn't have foot pain. You can go back to running. What would you do? And it's like crickets, because they've just become used to the system being unhealthy, and that's where they're stuck.
So this is a good segue into some of the things that I'm, looking to educate the audience about, is that in addition to the comments that Kevin is making, what I'm trying to do is give that person a level of gauge of how much I'm helping them and how quickly. And so if I'm looking at let's say this flexible foot type in the front of the foot is the most common foot type. In other words, the back of your foot stays the same, and over your life, your foot does that. And that reduces your balance, your support, because as it's doing that, it's doing this. It's collapsing. And the collapsed foot is not a supportive foot. So kinesiology tape is considered by insurance companies a medical non-essential or an experimental entity. And there's a code for a strapping of the foot, but you cannot be paid for a strapping of the foot that you're billing if you did it with kinesiology tape. And so I own my own brand of kinesiology tape that I fabricated very strongly so that I could actually take this flexible foot type and bind it into a position where it's arched and where it's stiffer, and where the inside um, the bunion area of the foot, this area over here. The analogy here is a scooter. A scooter has a rear wheel that's equal to the ankle or the rear foot, and a front wheel that's equal to the ball of the foot across the metatarsal heads. And it won't stand independently on its own until somebody lowers the kickstand. And what happens in the foot is that the bio kickstand of the foot is too flexible. The first met is reaching out. That's your bunion, because the shoe does that. And it's, as it goes into mid stance, it's not heel contact. As it goes into mid stance and that first met starts waiting, it dives up into the air and the kickstand can't engage. And so now you don't have balance, stability, and support of the foot. And so with kinesiology tape, I could engage the bio kickstand of the foot in that flexible type. And then I can make an insert that I call a dynamic foot brace. I'm old enough that we were making arch supports when I started podiatry school. I'll interject, by the way, my diploma reads M.J. Louis College of Podiatry. I was the valedictorian of the class of 1970. I was at Woodstock. So M.J. Louis was a physician, and he created a profession just like physical therapy or chiropractic or any one of the ancillary professions that are beholden to the physician community. A physical therapist is not allowed to take an x-ray. You can't take an x-ray.
Nope.
That makes sense, doesn't it?
Not a bit. I don't, like I said, I don't want to read it. Just let me.
So M.J. Louis, it's now called the New York College of Podiatric Medicine, but he was making sure that we would be subservient and that there were things we weren't allowed to do. And so the orthotic was made, the custom orthotic, which is what the arch support became right around the time that I was in school and a little after, was by prescription. And now that device was supposed to improve the subtalar joint position and prevent pronation of the rear foot, which I'm explaining most people's problem is in the forefoot. And by reducing the pronation of the rear foot, you're in heel contact for about a millisecond, and everything else is done on the front of your foot. So it's not done on heel contact, it's done at mid stance. And I am making dynamic foot braces. And the analogy here to explain to a client is it's like bracing the mouth. You have malaligned teeth, and I am taking those teeth and holding them in a healthier position as much as I can. And then there's, I don't know if you're familiar with Wolfson Davis's law. If there's pressure on a bone, it grows where the pressure is and shrinks down where it's not. And soft tissue, if it's contracted, it'll release, and if it's released, if it's stretched, it'll contract. And if you hold the mouth in that position long enough, you can take the brace away. And that's what I'm doing with feet. And so with those analogies, I'm now giving them a goal set and something that they know that brace in the mouth works,
right.
And they know a scooter doesn't stand up without the kickstand down. And I'm in a different world explaining to them what's going on, where they at that point says, you know what they say? Why didn't else tell me? I'm 45 years old. Why didn't anybody else ever say that to me? And so these are in the hands of coaches and trainers and physical therapists and chiropractors, and we're no longer physician bound for them. And neither one of those two things is insurance bound, because the code for a custom orthotic is L3000 or L3020, and my code is 99999, an experimental unknown entity that helps feet. That is not a covered service. You could put down, that you made dynamic foot braces and code it as 99999, and it'll be rejected 100% of the time. So I have everything set up for us to kind of explain it to things in a clinical treatment, as opposed to, here's why I know that you have plantar fasciitis. It's like saying to somebody, I know that the ocean is wet. And then someone else stands up and says, well, do you have any studies? Do you know what you're talking about? Do you really know? Well, I have a logical thinking mind, and this seems like a logical progression, and there's anecdotal proof, and there's low-level evidence, and that's kind of all I need when it's backed up by the things that I'm doing work.
So would you say, doctor, that everyone needs orthotics? Just athletes? Just people on their feet all the time?
Again, you're calling them orthotics. Everybody needs dynamic foot braces who does not have a healthy foot. And that's probably 80% of the people admit to some kind of foot pain during the course of their lives.
So would you say that no one has good foot mechanics or foot posture? What would you say the population?
Well, some guy who's obese and sitting on a couch and eating ice cream, he doesn't need me.
He doesn't need
he's not using his feet that much. So I'm being facetious when I say that depends on so many factors. What their sport is, what their education is, what their lifestyle is, what movement they want to do. You want to be in a gym or in a swimming pool? You're in a swimming pool, you don't need me that much. It's weighted. There are two areas of the body, of the posture, that are most often injured, and that is the first MPJ, where the bio kickstand is, and L4, L5, S1, because that's where we stand erect. One is the ankle taking the foot this way, and the other one is standing erect here at the lumbar spine. They show the lumbar spine, and then they show the extruded, discs. It's always L4. They say to me, I have flat feet. And I say, and I had spinal surgery, and I look at them and I go, L4, L5? And I'm right like 80% of the time. So
Absolutely.
all of these things, that's my experiment. That's my evidence.
That's your evidence.
When they say that's unbelievable that you would know that, I'm building a rapport with the client, and now, please pay me at the end of the visit. Or again, what I say to them, please tell me if you're indigent, if you can't afford me. I make enough money, and my people pay my good fees, and tell me what you're willing to pay me. And that's how I pay back, people in general, so to speak.
That's nice.
I'll let you go back, Mike, Kevin.
So now if someone's listening to this and they want, now you have a certification course for medical providers, correct?
Well, I in other words, again, I wish to control these tools and this science. The science is called the foot centering theory of structure and function. So we're talking bioarchitecture and biomechanics. And so in order to do that, you need some kind of governing body or some kind of education to demand it. And between you and me, to shove a foot into a box of foam properly and send it to a lab that's certified to make dynamic foot braces, you don't need 4 years of college and 4 years of medical school and 3 years of residency. You just don't.
Okay.
You just don't. And so I have a certification course. You get didactic material in the foot typing method, for instance, and a 33-question test. And when I was board certified in foot and ankle surgery, and we had to renew our certification every 10 years. It was $2,000 to sit for the test, and if you failed it, you had to pay another $2,000. And think of the bar exam. There's some people that never pass the bar exam.
Right.
So mine is educational. You take the test, and let's say you get a 42, and I show you which answers you got right. And now you could learn how to answer the others. And it's kind of like you don't really learn to drive until after you pass the driving test. But at that point, the only people who could make a dynamic foot brace or apply kinesiology tape foot type specific according to the patents I own are people who are certified in functional foot typing. Okay. And so then we have a certification on how to cast and make the inserts. And we have a certification on how to use the kinesiology tape. So it's a Keystone, I think they call it. It's a turnkey operation that's pretty seamlessly learned in a relatively short period of time, and you have the laboratory and me, in other words, me and my organization. Excuse me, I don't know the answer to that question. I'm going to let you know in an hour, and you kind of call up and we give you the support to answer the question, and so your confidence level is there. You don't have to make things up. There's only 5 foot types, so by the time the person sits down and you take literally a 2-minute examination, you know what the foot type is, and you've handled it many times, and it's just like saying that you see the same Tommy John problem or the same,
Sure.
I'll let you go back, Kev.
So how do people, if they want to get more information and get in touch with you, what should they do?
Well, I could we leave that till the end? I'm
Sure.
rolling.
Well, yeah, we're getting there. Okay.
So how do you become direct pay? This is a process that I did over 10 to 12 years. I'd like any of you have, practices. Just jot down in your mind or on a piece of paper right now, what's your hourly turnkey rate? It's an accounting term. I don't know if Kevin knows his. Most doctors, that's like, I don't know what. It's worse than organic chemistry. It's how much it costs you to run your office for 1 hour. Every expense that you have, take your malpractice, your cost of goods, your staff, your rent, your everything that it costs you, and let's say it comes up to $400 an hour. So the first plans I dropped out of is the one. So that's like, say if I was doing a 15-minute visit, and I don't think I've done one in my life. I've never made a phone call for less than 15 minutes. But let's say it's $100 every 15 minutes. If an insurance company is paying you $85 for that 15 minutes, you can't make it up with volume. Okay, so that's a critical thing to know. And again, those were the plans that I dropped out of first. And I raised my fee to $250. And if I saw 3 patients in GHI instead of 9 patients, if I saw 3 at $250, I made $750. And at $58.28, you added up how many I had to see to make that same money. And then the people that I was seeing were sending like-minded people. They were sending people, this guy is really good and different, and it's worth whatever, you got to pay. And then someone, when they get sticker shock, I grew up in inner city Brooklyn. My dad drove a yellow cab. I didn't know I was poor. Podiatry school cost me $1,000 a year. It's over $100 now. And Brooklyn College cost me $58 a year. And God bless America. I'm a true patriot and a proven model. There's no other country where a cab driver's kid becomes a board certified surgeon. So I've always taken care and given back to the community that took care of me when I was young. And I'll say to them, so how much can you pay? And if I know my hourly turnkey rate, it's $100 every 15 minutes, and they're willing to give me, let's say, 80, I'll make it up with those 250s. And at some point, say I used to give out shoes to diabetics and socks to diabetics in the winter in New York. And eventually I had to say, I'm not making it. I got 5 kids. I have 7 grandchildren. I'm not making enough money to do that anymore. I just can't do it. And eventually the only thing I could do was leave the world that I was in, leave the insurance world. I'll kind of stop there for a second.
Yeah, the insurance. The only way you can make up that cost, or what other of my colleagues are doing, is by volume. Seeing 3-4 patients an hour, which is just really diminishing patient care, and it's diminishing the outcome that people get. But
it's also, there's a 5% reduction in Medicare again, yep. And other insurances are based on less than Medicare. Medicare used to be the lowest paying thing. I grew up in a world that was called the Golden Age, indemnity. I sent Prudential a bill for $3,000 for an injection, and they paid me $3,000. And I couldn't believe that they were paying me that kind of money for an injection, you know. And
Doesn't happen
now,
anymore.
again, I left insurance on my $6,000 plantar fasciotomy, you know, surgically treating plantar fasciitis in a really aggressive acute case, went to $438. And I said, I'll never do one of these with the responsibility that I have as a surgeon. And that included a 90-day global period, which means I had to pay for all the redressings because you weren't allowed to bill any other additional office visits. And the guys who are making the money today are the guys, they pay full dollar for the screws and the plates and the whatever, you know, whatever shiny things they're putting in the body, the implants. So I have always found a way to really explain to the client that if you have an $18,000 deductible and you're paying $1,200, you know, a month for your family,
You
the
don't have
first
insurance.
$30,000 is out of your pocket.
Yeah.
Just take 5 of it and give it to me. You know, you won't have to go to the doctor as much. You won't have to.
Right.
You'll have a different lifestyle, and there are 7 different things that I'm trying to work with a client, and it's nutrition, exercise, stress, sleep, and there's 3 more. I don't remember them, but you get what I'm saying. But I always do it with thinking about one to the other. I'll use a nutritionist who takes you from one insane way of eating. There's 4 states now where the #1 body type is obese. They're mostly in the South. And by another 6 years or so, it'll be half the country, if the plan continues. But at this point, I kind of say to this person, what I want you to do is eat this other insane way where you starve yourself, eliminate everything white, eliminate like your 10 favorite foods, and create this stress level that you don't need. And so my diet includes, you know, reductions, temperance of other things. But I'll say to the client, what's your 5? With me, it's like ice cream, potato chips. And of course, I eat a gallon or the whole bag. And now I say, well, there's 4 weeks in a month. I want you to take your favorite 4 and do one of them once a week. You know, cut a piece of salami on Saturday night and you know, a big stickle, my father would say, a big piece of salami, and eat it. And you won't be stressed out. You go to a restaurant, you can pig out with your friends, and you know, you go on a cruise and treat it like a vacation. And that way you're establishing a maintenance diet. What happens is, little by little, that ice cream just doesn't taste so good. And it's really what happens. You know, the brain's pretty smart, so to speak, most of the time.
Most of the time. All right. Well, let's. So how can someone get in touch with you if they want to work with you?
So I'm in other words, I had 2 websites. One of them was my hobby, which was this. The other one was my practice. And I'm now in the process of redoing those websites professionally. But it's www.foothelpers.com. And I'm on LinkedIn with a big presence. And I'll give you my cell phone number, which is 845-536-3338. Right now, I only have one. I had 6 staff in Manhattan and a $7,000 rent that is gone now because I'm down in Tampa. And I pay a $500 rent to be the health coach in SNAP. So I've eliminated or reduced that on that end, and I'm cash only, and I don't have to support like I'm laughing. It's like funny. My malpractice as a surgeon was $31,000 a year. I just now renewed for the year. It was $800 as a health coach.
Wow.
So that's you know, $28,000 that I don't have to come up with.
Wow.
So little by little it works, and now you're respected as a professional. Now You go to the gas station, who happens to be your client, he gives you a break. You know, you have a different status in the community, and the doctor is not of. I can't answer. I'm sorry, I can't answer any more than your third question. Make another appointment, and you got some pain. Well, here's some opioids, and 10% of you are going to commit suicide or die of fentanyl poisoning, but I won't have to bother with you very much, or send them to a physical therapist who's the one tidbit I would say in terms of if there are patients out there, never go to somebody who's using a lot of hot and cold packs and stretching, because that way they could have 9 rooms working at the same time, and staff just taking on and off the hot pack. What I'm doing is I'm taking a muscle that's overworked and a muscle that's underworked. I'm going to back up a little bit. And what we do surgically is we work on that. You stretch and stretch and stretch that tendo Achilles until it's like this. And now you've got a balanced system that's weak. And the counter to that is peroneus longus, flexor hallucis longus, abductor hallucis. And what I'm doing in exercising is making them stronger. And now I've got a balanced, powerful system that could work the bio kickstand, and that can balance both sides of the foot and turn us back to, I don't know what, I guess Bruce Lee.
That's right. Like water. All right, doctor. Well, hey, thank you. We'll definitely have you on again, but thank you for coming on today, and definitely spilling a lot of knowledge that people need to know. People need to know about cash-based practices and cash services and preventative measures that are out there. So thank you again, and look for us on YouTube. Please subscribe to our channel, and if you need to reach me, 978-651-1812, you can reach my text line, Text Game Show. And thanks everybody for listening.
I appreciate the opportunity.